Okay, let's walk through a code blue. A code blue is when someone has cardiac arrest and their heart stops, they don't have a pulse. So usually what that entails is, from my perspective, I'm usually not the one detecting a code blue. It's usually like a nurse or someone else with the patient. So a code blue goes off on my pager or overhead. I run into the room. Sometimes code blues aren't real, like it's there's something else going on, but sometimes you come in and we're actively doing chest compressions. So at that time, you immediately get someone to start recording what we're doing. That's very important. Like, okay, and you start giving epinephrine, big doses of epinephrine, and you want to know because you do things every 2 minutes. You dose medications every 2 to 3 minutes. So as you're doing chest compressions, every 2 minutes you stop and you check for a pulse. If there's a pulse, you stop doing chest compressions. You also check the rhythm of the heart. Some rhythms you can shock, and which is called defibrillation. Some rhythms you can't. It depends on which rhythm is going on. So you stop, you check the pulse, you check the rhythm. Sometimes you shock, or sometimes you don't shock. It doesn't matter. Either way, you get back on the chest and you start doing chest compressions if there's no pulse. As you keep doing this round after round, and then you start getting off labs, you start kind of thinking about your differential diagnosis, what's going on, what are things that we can do. I always, ask the room, shouting out exactly what I think is going on. I ask for other people's opinions. During this, someone is getting an airway, someone's putting in a breathing tube, we're getting more IV access. Sometimes you have to do intraosseous IV, which is you drill a hole in the bone to get IV access. Meanwhile, you're still doing chest compressions. Sometimes you can get them back. When you do, then it's a whole nother thing to try to figure out what happened and to keep them alive. It's generally, now this is just my opinion, if you're going about 30 to 45 minutes of this, doing chest compressions, for me, it's around like a 40-45 minute mark, depending on what's going on, that you should probably decide to stop. That's when having families be in the room to witness all this is good. I think it helps them process things, and it helps in the decision making to say, I think we've gone as far as we can go, and I think it's time to stop. And then we stop, and usually I do a moment of silence for the patient and exit the room and let the family be with them.